go live, so hopefully that will work. And I am going to come back here to our broadcast. I feel like we missed a week and I've been a little out of sync. Okay.
Okay, so now I'm going to
let
Facebook.
me put the recording on. Oh, we are now recording. Look at our chat. So thank you everybody for being here for another installment of our COVID-19. Hey, Arnie Paulson's here from Edmonton, Alberta. This is actually our 9th conversation on the coronavirus. It's the 10th in our sort of ongoing series because we did 1 week on fasting during Mother's Day. And today, because we had some people asking the last time we met 2 weeks ago about how to handle our emotions during this time, we thought that we would talk about that because it's in my wheelhouse. I teach emotional processing work. I work in my coaching. Part of that is emotional processing. I believe that the more time we invest in our process, the more magical life becomes, even in the most challenging of times. So we're going to start. The first part of this session will be focused on coronavirus, COVID-19, and where we are with that. Karen will give us the state of the coronavirus as it is. Today's May 31st, 2020, last day of May. We've now been on, in sort of shelter at home, shelter in place, well, at least in California, since mid-March. So it's been like about 2.5 months, I think longer than we all thought it would be, or maybe wishful thinking, all that we wishfully thought it would be. So I'm having some emotional feelings about all of that, plus all of the craziness that's gone on around the George Floyd incident and the rioting and all of that that's going on. So it's actually a perfect time to talk about emotions, I think, today. So, and Karen, we just completed the group that she was in and went through my Invisible Warfare group program.
And I strongly recommend that. If I found it just wonderful. Like, I had been working on things for years, and Invisible Warfare made the difference. It really rooted out some beliefs that were holding me back in a lot of ways in my life. So I'm going to give Kristen a recommendation on LinkedIn. I do recommend it. In fact, I enjoyed it so much. I'm starting now, like, this is the book she used. This is the Invisible Warfare. I'm starting to go through it again with another friend. A friend and I are going to do it. So
love that. Thanks, Karen.
Yeah, I'll reinforce it even more.
It's amazing work, which I'll share some more when I talk about emotions in the next part of chat that we're having today. So if you have questions, I see that we've got in the Q&A. Please put it in the Q&A. It's the bottom of the screen. Jean's here from Bethesda, one of our regulars. If you have questions, please put it in the Q&A. If you are watching this on Facebook, please put it in the comments and I will monitor that. Thank you for reminding myself. I'm going to pull that up on my phone. Just as the announcement I need to make in the beginning of this, Karen is not a medical doctor. She's a scientist, and she will be talking about the coronavirus from a scientific perspective. She spends a lot of time and energy educating herself about what's happening in the world of COVID during the week so that she can come to us with her expertise in these conversations. So if you're having some sort of medical emergency, call your doctor.
Yeah.
Karen is not a doctor.
That's what I'll do. Yeah. Okay. Okay.
Like she never do. Okay. So Karen, let's
Okay. Well, I want to just give a few updates. As this has gone on now, some of the things that we just said, we don't know, we're starting to home in on some answers to things that people have wondered about, and have asked several times. And I can only say, unsure. Today, I'm going to give you a few updates on things we've said. Again, it's still not perfect, but we're starting to think we understand a few things a little bit better. So first, first things first, I'm going to share my screen. Can I still do that? Yep. Okay. I want to show you something that was a little bit surprising. Okay. I'm going to go into my, let's see, I got to go back. I don't know how this will work. That was my Facebook page. Can I get, I want to get to,
Move your computer works when you have that many.
Are you seeing my
windows
computer?
open. Yeah.
Yeah, I'm just trying to get to the right page. You know, do you see my computer screen?
Yep.
Okay, so what I want to show you that's interesting and what's important, okay, what is really critical, and I want to show you this. Okay, this is by country. Now this, I was just talking to a friend who lived in Wisconsin, so I'm going to use the Wisconsin thing as an example. Okay, what I expected and what a lot of us in the field expected, this is not actually a date. This is just the number of days since there were 1 case per million people. But again, this is the Wisconsin line. This blue line is Wisconsin. Now, if you'll notice that first hump right around here, this hump right here,
Yeah.
that was their peak. Now, what we all expected in the field is to see something like this, that, you know, it would stay on the peak a little while and then go down. But notice what's happened at the peak, it's plateaued. It's hung on the peak. And sad to say, Wisconsin particularly has a problem with the meat packing places. You know, that's a big, you know, what do you call it? Pork, and you know, there's a lot of animal. I just lost when I moved it, I kind of lost it, but I think you could remember what it looked like. Even so, like, it's, I don't know why I'm having a little computer thing. Could that be the Mercury retrograde?
Are we in Mercury retrograde?
I believe so.
Oh, I didn't even know.
So,
Now I know.
so now you see it going gently upwards. Now, part of that is because of the meat packing, but a lot of other places. I want to show you Washington, D.C., which is a new hotspot, by the way. The Northeast corridor is just bad, okay? Now, this is Washington, D.C., and this is more typical. The only place now that has more new cases per day per capita is actually Rhode Island. But look at what DC is doing. That blue line is now DC, and you know, the DC, Maryland, Virginia, this whole area is kind of a place where there's a lot of cases. We have started gently reopening, but you might start to see, like, you could imagine that this is a whole plateau. The plateau went for a long time and then started going down. So this surprised me. I didn't expect us to be on the plateau as long as we were. I expected we'd go down faster. And presumably what people are saying is the reason this happened is we were doing very well at social distancing. And we didn't get to herd immunity fast enough. So I want to go right back. We have a little bit more. We're still not there in terms of, this is the United States. Now, you notice how the United States has this long plateau too? That's us. Let's look at Sweden. Okay. Now, Sweden looks very, very similar, okay? Sweden and us, remember, Sweden didn't lock down, okay? Which, it's a little bit misleading because a lot of people did it voluntarily. Okay, Sweden didn't lock down. A lot of people did it voluntarily. Vulnerable people were protected. And on a per capita basis, when you look at it, here's the United States right here, okay? United States and Sweden, compare them, okay? Compare the brown line. Let me see if I can drop this just a tad bit so you can see better. Okay, on a per capita basis, okay, so this is a good comparison. On a per capita basis, at the peak, at the US peak, we were way worse than Sweden. Again, we weren't locking down then, But as we've started to lock down, and Sweden has done it voluntarily, we're pretty comparable, and Sweden is actually better. So there's a lot of people, and there have been public health specialists saying this from the start, that we probably didn't have to do as much of a lockdown as we did because we were completely unprepared. I think it made perfect sense if we had been better prepared. We had flights into New York and all these places. That was part of the problem, and we didn't have plans. If we had been better prepared, and we are going to be prepared hopefully for the second wave in the fall, which will be worse, okay? I think we're going to be able to be like Sweden and have a much better experience than we had in the first wave.
What does it tell us? Like, if Sweden didn't have a complete stay-at-home order, people chose to stay at home who were immunocompromised or elderly, probably, right? If our graph looks like theirs, but we stayed at home, like, what does that tell us?
It tells us that we were completely unprepared. As we got better, we have to think of a couple of things. This is a per capita basis, and the US is a very different society than Sweden. The cities are not as densely populated. What can still be said, there are 3 times as many cases in Sweden as in Denmark and Norway and Finland, right? Per capita. So as compared to countries like them, not locking down got them a lot more fatality, okay? There is always going to be collateral damage. The thing about viruses, they are self-limiting. We've defeated far worse, and we will get to herd immunity. And by locking down and social distancing, that was not to extinguish the virus or to prevent its spread. It was to make it spread longer, but have the cases trickle in to not overwhelm the health system.
Right.
Okay, we didn't overwhelm the health system. In fact, most of the time there was still a little excess capacity. So we've learned a few things. We can probably be a little less extreme in our lockdown, because now we are looking at a situation, we're looking at a country that hasn't had this many people out of work since the Great Depression. And we're at severe economic risk, okay? So interestingly, we've still got this plateau. I believe the science, I'm still on this. We're just getting hot in DC. The virus doesn't like heat and sunlight. And we've also got a new data from China. And this, I think, will make a lot of people happy. There's only one confirmed transmission that happened outdoors, okay? We've always said, when you're outdoors and you're moving, you're masked, that people are going by each other quickly. That's not how you get this thing. And we've only found one case of that in China. Where you get this thing, I've said from the beginning, it's being indoors, cooped up, bad ventilation with sick people, right? And infected people. We're also starting to see that the fomite transmission, touching surfaces, etc., is probably far, far, far less important than we thought initially. Initially, we were thinking it's fomite, surfaces and clothing, because I think there was a little hesitancy to admit that it was an aerosol virus, which it was. I mean, any respiratory virus is aerosol by definition, right? So it seems to be the most common transmission is being crowded and breathing the same air with infected people, whether they're symptomatic or asymptomatic. In family transmission, we've always said is super high. So now we're starting to see that's the primary mechanism. Outside walking past people, farmers markets, they're not severe transmission locales. Another very good piece of information that we're thinking is real. Kids, they can get it. We know kids can get it. But unlike many viruses, they don't seem to be the vectors moving it around. Child transmission isn't really the means by which it happens. In other words, your kid gets it at school, doesn't get sick and brings it and gives it to everybody in the family. No, that happens with other viruses. But this one, so this bodes well for reopening schools.
And does that have something to do with the viral load that the children have?
We just don't know yet. It's the children, we're studying children deeply because we know they can get sick and we know they can have real problems. But still, as a whole, well, we do know that the asymptomatic carriers trend young. Those loads are much lower than average. So yes, there's an element there. The kids aren't getting sick, they're containing it somehow. It's not replicating well in them. And maybe they don't have as many of the ACE2 receptors in susceptible places. There's also a very simple kind of equation. Smaller lungs, they may have the same number of receptors per square area of lung space, but their lungs are smaller. I mean, it could be any number of things. It could be an immature immune system. We know that this virus, like SARS and like many other severe viruses, it causes a cytokine storm. It causes an overreactive immune response, especially early on. And, a strong pro-inflammatory response doesn't bode well. And a less mature immune system can't do that quite as well. Although we certainly know kids are getting that Kawasaki-like, strong immune response. But again, it's a very small number of kids. Is it a particular genetic background? The jury is still way out on all these questions, but we're starting to get a better sense of what's really a risk. And again, people were reopening, going back to work. Here are the three C's, I guess they call it. Crowded. Don't be in a crowded space. Don't go to big meetings. Minimize your time with lots of people and use masking. Okay. Keep social distanced. If you are working on helping come up with a plan for reopening your place, start with maybe 25% of the employees and then gradually build up. Bring in the least susceptible first. If and those who have recovered, if you've got people who've recovered, they're probably immune. So be smart about who comes back first. The low-risk people come back last, obviously. Make sure you can keep people 6 feet apart. Don't do meetings, and maybe even don't do a full 8-hour workday. Start with 4 hours and some hours of teleworking. And then if you're starting to see problems, be prepared to back it off. So I think we're seeing, I'm a little disappointed that that we hit the plateau and it didn't start to turn around as fast as I had predicted or hoped. But we're getting into the sunlight. Viruses hate that. It's going to be hot. Enveloped viruses hate that anyways. Let me correct it. So I'm feeling a little bit more optimistic, and we are starting. We're nowhere near herd immunity, but we're taking baby steps towards it. So that's
Karen, you started talking about the 3 C's, and
crowded, don't congregate. What's the last one? No, I forgot what the last one is. But effectively, it comes down to this. Oh, close. Don't be too close. Okay, so crowded, congregating, close. Okay, keep apart. Start getting out there a little bit. If you can meet your friends outdoors, sit down at a cafe. In DC, restaurants open, but only if they have outdoor seating.
Yeah, the same thing is happening in Santa Monica.
Yes, and you can go to an outdoor cafe, keep apart, wear your mask when you're not drinking your coffee. But outdoor transmission is not as common. Outdoor transmission isn't high risk. Of course, if you're in a small space outdoors and very close to people for a long time, minimize your time, just meet your friends rather than hanging out for 2 hours, meet for 20 minutes and say goodbye. Be smart and you'll protect yourself as much as possible.
Karen, with that thought, does that mean that, in your opinion, that is
In my
not,
opinion, always.
in your opinion, that is not as important to wear a mask when you're outside, or would you still wear a mask, or what are your thoughts about it?
I'm still wearing a mask just to keep the aerosol load low. And
Yeah.
particularly if you're going in a place, like if you're running on the beach at 5 in the morning and there's not a soul there, obviously a mask is unnecessary. But when you're going to bump into people and maybe chat, I mean, you just don't know when you're going to do that. So I'm keeping my mask on for those reasons, right?
So when you would have a chat with somebody and you'd be a little closer in proximity, you'd have your mask.
Yeah, you might, and again, like nobody's perfect. You might inch in a little closer, a little, distracted. People are starting to feel a little more relaxed and they're forgetting the 6-foot rule. When you're in a store and they put a line at the takeout or whatever, or at the counter, at the checkout line in the grocery store, what 6 feet is. But when you're feeling a little more relaxed, it's a happy day, it's sunny, you might walk a little closer to someone they probably is advised. But again, we're starting to learn more, okay? And we've known the people who are high risk, we know that pretty clearly now. And vitamin D, guys, that's really, we're converging in on that. Vitamin D, make sure you get out in the sun and get yourself converted. If your vitamin D levels are naturally low, like mine, you might want to take a vitamin D supplement. That was recommended to me by my physician, and I was doing it before COVID just because I'm so low. The data are very strong there. So a few things.
Yeah. So Karen, I have a couple of questions for you. I'm bummed because I saw a headline that said, I'm wondering if you read this article or saw this headline, that it was conclusive that the virus was not spread in the Chinese market. Did you see that?
We don't know that. What we do know, and this reminds me, I sent Kristen an article that I think everybody should read because it did change my view a little bit of China. Now, don't get me wrong. I've said from day one, China could have shut this down if they had gotten on top of it, been transparent, called in the best experts in the world and said, help us, we got a problem. But I read an article in Foreign Policy magazine, which really impressed me because I was unaware of certain things. And I changed my opinion a little bit about Trump pulling out of the World Health Organization. 100 countries have called for an investigation into how WHO handled the pandemic. And I also learned that the Ethiopian guy who's the head of WHO, the former Minister of Health in Ethiopia, actually got his job with Chinese backing, okay? And there was quite a bit, either he believed the Chinese naively or he didn't, and he deliberately covered up problems. The Chinese were saying the virus was under control when we were at the peak of the epidemic in Wuhan, and they were building 2 hospitals in early January, right? And the WHO, until way into this, were saying, oh, it's not aerosol, it's not gonna be a problem. I mean, a lot of why Fauci was wrong early on was from listening to the WHO. And there are some definite reasons to believe that the WHO, it's one of 2 things. Either they naively believed or they deliberately got in bed with the Chinese to downplay the severity here. And I hadn't really appreciated that. I also was very grateful the Chinese released the viral sequence as soon as they had it. Well, it turns out I was wrong with that. They hung on to it for 10 days, probably to give their own biomedical industry a head start in producing vaccines and therapeutics. That's why you do that kind of thing. So I've changed my view a little bit on that. I don't know if Chinese numbers are right. I don't know that we can conclusively say it didn't come from the market. I don't know. So that's still, the jury's out on that. I don't know. And it may be too late to find out, sad to say, because you've got to look at this close to the index patient 0. We may never know where this came from. And that is very scary, because there's another one out there. You know, there's another one waiting for us. And if it's more fatal and more transmissible, we're going to have a worse problem. I just hope we use it as a good wake-up call for the future.
I did try to read that, or I started reading that article, but because I wasn't subscribed, I couldn't finish reading the article.
Oh, really? Is that so? They're letting the COVID stuff out for free.
Yeah, I don't know what I had to do, and I lost track of it. So
make a free account or something. But yeah, if you need it, I'll get it to you.
Okay, thank you. So a couple other questions on COVID, and just so you guys know, if you have any questions on COVID, please put it in the Q&A. If you are watching this on Facebook, put it in the comments. I have Facebook up here on my phone, so I'm monitoring that. So if you have any questions, please let us know, because we still have another 15 or so minutes that we'll be talking about COVID specifically, and then we'll get into sort of navigating emotional health during this time. So, and I always have lots of questions, so I'll ask now that no questions are hanging that I know about. You know, it's interesting. I'd read an article last weekend. I hope everyone can hear me because I've got helicopters above and water happening. So can you hear me okay?
I can.
So anyway, I had read an article that had provided some statistics. And I was like, oh, in this article, it said 5.2 million people in the world have contracted coronavirus, COVID-19, and 340,000 have died. And so I just did the quick math and I was like, oh, 6%. 6% of people that contract this disease die. And then it was funny.
That's way high. That's way high.
I was having a conversation with my brother the next day, and he had done the same math, but he'd done math with the numbers from the US specifically, and I don't remember what those numbers were, but he also came up with the same number, 6%, which I thought was interesting because I was using the worldwide numbers and he was using the US numbers. And I'm curious, you're thinking that's too high.
That's way, way too high. Here's why. Even people who know they have it, have had all the symptoms and recovered, the only people, okay, I should qualify this. The problem with all the numbers is there's great variability on who we're counting as infected and who we're counting as having died from it. First of all, who do we count as infected? They've had a test, right? So a lot of people that we're absolutely sure had it have never been tested. A lot of people are asymptomatic carriers. We don't quite have the percentage, but it could be pretty darn high. We are thinking when all is said and done, okay, so let's just say that's why the numbers of infected are way low. So they're way low. Now the number of deaths, generally speaking, and this is very variable around the world, and this has even been a little controversial, people who were tested and died in the hospital and we know they had COVID, that's a clear COVID death. But if you died at home with COVID-like symptoms, some localities, and it's even variable within the same state, are counting that in the COVID deaths, some aren't. And they could be wrong, okay? Some deaths that are clear COVID deaths aren't being counted as COVID deaths. We are estimating that the true death rate from COVID could be as low as 0.1%. It's definitely under 1%. I shouldn't say that. Let me take it back. We don't know yet, but it's not 6% by any means. It could be a couple of percent, but it's most likely going to fall out to be under 1%. And it's very, very different from country to country, because here's what contributes to a death rate. It's not intrinsically the virus. The virus is one factor. The second factor is the age and the health status of the population. And the third factor is the timeliness and how good the public health measures are. We've already got places where the death rate is 0.1%, like Taiwan. I think it's even lower than that. And we have places where it's higher. So until the first wave is over and we make some estimates, I don't think we know the death rate. And the US death rate will surely be higher. One thing we are starting to see even more strongly And again, it's variable. Sweden has a higher percent, but 43% of US COVID deaths between 43 and 50 are happening in over 65 people. And those guys are sicker to begin with. In some countries, it's a much higher percent, okay? Yeah. So because the background population, the younger people are healthier. So this is a disease that gets you when you're older and sicker, for the most part. Now, we know kids and young people are getting and dying of it, but in general, those are the realities. The vulnerable people are succumbing at much higher rates than healthy adults. But I think as far as percentages, I think it's evening out. The fact you both got 6%, those that overcount, those that undercount, they even out. And we're looking at, from data, we're getting 6%, but the data are
Well, the data is not good right now.
The data is very under counting, particularly in terms of cases. That's going to be the tricky part, the denominator. The deaths are a little easier, even if you want to assume something was a COVID death. That's why the Chinese deaths suddenly spiked up in the middle of February. The definitions of the disease changed, and so we may never know exactly. We don't know how many died in 1918 pandemic influenza. Okay. So
my computer's having some problems today, so we'll see what happens. I hope you can hear me. Oh, it says I'm not responding.
I can still hear you fine. Yeah, you guys maybe are hearing some, sirens and things from my end. Like we had a rough day yesterday with the George Floyd protests. Largely peaceful, but in Lafayette Park, there were some things set on fire, and there were a few bad things happening. So while Kristen tries to get us corrected here, if you have any questions, put them into the Zoom webinar chat, and I can answer them even if I'm frozen. Oh, Kristen's frozen. I think Kristen, we just lost Kristen. Am I still here? Because she's the host. Just type in any questions and I'll answer while Kristen is coming back online, and then we'll move over to the mental health part, which I'm also looking forward to. Oh, I see a question from Jerry. Looking for information about conditions when it could be safe to have 5 singers spread out in a large sanctuary space with an accompanist and a couple of others. Asking for high holidays in September plus rehearsals in late August. Does the aerosolization make it too dangerous for any number of singers, even if spread out 12 to 25 feet apart, and they are the only people in the space? Air conditioning, no windows to open. Okay, this gets harder to answer. Spread out 12 to 25 feet. Here's the nature of aerosols. Aerosols hang in the air for several hours. Now, if they're highly dispersed, like the singers are separated by a huge amount, there'll be less. The concentration of those aerosols will be lower. So saying it's 100% safe, I mean, if there's good airflow, if you've got air conditioning, you probably have, air circulation in the sanctuary. And look at how things are in August. If you see the cases are off that long plateau and are getting way down, that becomes a lot safer for you to do, okay? It's very tough to say. I mean, we know that singing generates a lot of aerosols. And I think one good thing to do, and by the way, another thing I wanted to mention, we're learning now that 50% of the antibody tests are inaccurate. The kit type tests. When you have a blood draw at a doctor's office, those are in the accurate category. Now, Mary Clark, the idea that COVID-19 is a blood vessel disease, I have been saying from the start that it's not quite that simple. It's not just a blood vessel disease, but inflammation causes turbulence in the blood flow. And I think there's a veterinary disease, feline infectious peritonitis, where you have antibody complexes binding in the capillaries and the blood vessels that cause fatalities in the cat. I think there's a lot more to this than meets the eye. And I wouldn't go, by no means is it just a blood vessel disease, but some of the severe manifestations and even the serious pro-inflammatory stuff, we might find that there's a little more to that than we appreciate. Jury is still way out on that, but COVID is a respiratory disease. We know it does get you in the alveolar sacs. We know it gets to the heart. We know it can get into the kidneys and even the brain. We know this. So again, as we've said from the beginning, it's never good to think of something as intrinsically a virus. It's a host-virus interaction. And it's like two sides of a war. And the stronger one is gonna prevail. Now, the virus gets stronger when the load is higher. The human gets stronger with a stronger immune system and good health and good healthy practices. So then the two are pitted against each other, and the stronger one is gonna win out. But generally speaking, the pathology of COVID is our own immune system overreacting. Viruses can do one thing and only one thing. They self-replicate inside the cells. But the viral proteins start manipulating us in various ways to make it more conducive for them. To me, as someone who worked in this field, that's a better way to think about pathogens. It's a competition, it's a battle. And those pathogens who are better at subverting host defenses tend to be more lethal. But we can make ourselves as healthy as possible and be vaccinated. That's a way to kind of be pre-prepared. It's like vaccination is a way to sort of put up fortifications before the enemy arrives at the gates, if you will. So anyhow.
I lost you for a minute. I went left and came back on. So.
Yeah, we saw you had to like reboot or something, but we carried on,
Excellent.
But I'll keep looking for that. For Jerry, I'll keep looking for any more information that can inform better on these kind of questions. Go to the CDC website. There's like a workplace opening, like kind of road plan. Like there's a lot of good advice for how to bring people together in workplaces. And a lot of this will apply to you. Being that far apart, question is how many people are going to be at that, in that synagogue for the worship. There's just these are the kind of situations that can be very problematic. So
I don't know if it was because they were going to mass, but Adrian and I were out and coming back before this, and they had someone at St. Anne's Church, which is a church in Santa Monica. People were pulling into the lot. I don't know if they're having mass today or not. I know that at St. Monica, which is our church, which is right down the road in Santa Monica, they were talking about opening as early as next Sunday.
Yeah, there are some places where the churches were the first things to reopen. Again, that's a place where it's very difficult to social distance, right? If you're trying your best, if the church has good ventilation, if you're opening windows in this cross flow, it's better. Does that mean there's a guarantee? Nothing. I mean, there's no guarantees here at all. Does that make it smart? Again, the 3 C's. congregating, and that's the definition of a service, a
church.
congregation, right? I mean, you're congregating.
Yeah.
You're close together.
Jerry Robbins, but no congregants, right? It's the congregation. Yeah.
You know, exactly. Like it's, and again, but Jerry, you got time. I mean, August is still a long way away, and you might very well be in that lull before the second wave hits, in which case it'll look really good. Okay, you're just talking about you're going to Zoom the congregants in and it's just you guys. Well, then that's way safer. I was thinking the people will be there, but that's way safer.
So we've got a couple more questions, which we'll take, and then we'll at least try to leave the last 30 minutes for the emotional health piece.
Yeah, I want that too.
Me too. So some anonymous attendee asked, will we be ready in the US for the fall COVID-19 reoccurrence? Will we be more likely to embrace herd immunity?
I think we're not going to be quite, here's my prediction. This is based on what we've seen. Again, somewhat of a prediction. The CDC has ramped up hiring like no tomorrow. Okay. So there's we've gotten a wake-up call. The public health structures are being put in place. It's still going to be, the national leadership is still weak. So I think it's still going to be a bit of a patchwork, but I think we're going to be far better prepared for the second wave than, I mean, there's no doubt we'll be far better prepared for the second wave. I think what we've learned from Sweden and in our own place, we've learned that we didn't swamp out, and we still always had a little bit of healthcare capacity, and we've got a tiny bit of herd immunity. I think we're not going to see lockdowns quite as severe. The vulnerable might want to rethink it and just, you know, vulnerable should not be playing games under any circumstances, okay? 43% are over 65, even without complications. And if you want to refine it more, you're going to find that 80% of people who died were older and sick.
Okay, so Bev Reed asks, hi Karen and Kristen, what are the general guidelines for the more vulnerable? I have a very bold and seemingly healthy husband who is 68, liver transplant recipient, still dealing with metastasis. Thank you. Of the liver cancer in his lungs, surgery-induced diabetes and high blood pressure. In a nutshell, how should he go about living his life? We've been extremely limiting our movement, but he just wants to go to the grocery store, something we haven't done since March. What would you do?
Okay, and I can tell you another thing, cancer, people undergoing treatment for cancer, we don't have a lot of data on that because, you know, they're taking care of themselves and they're self-isolating, but we've seen extremely high death rates with that, with people like your husband, extremely high. I wouldn't even think of letting them into a grocery store, but what I would do is you can go to a grocery store. If you're trying to prevent yourself from getting sick so you don't bring it home to them, I would say keep on like that, but he can get out to go outside now, be outdoors in a place without a lot of people around. Don't go into a store, a grocery store. Keep away from crowds and congregating still a while longer. Where do you live, Bev? I think, are you in Bethesda? Are you the person in Bethesda? Look at your local case numbers. When they're down almost to zero, that's when you may be, like, I know he probably wants to do something.
Bev's in Kirkland, Washington.
Okay, so you're in Washington. You guys got hit fast, and so you're way better off. Look at your local case numbers. When they're way, way low, then start, like, maybe going to a grocery store or another store that he wants to go to. But honestly, what you just described is one of the most vulnerable I can imagine. So I would tell him to, you know, unless he wants to depart this world soon, be a little more patient.
Yeah, it's really, there's a patience piece for all of us.
Oh, for all of us.
I think Liz is in emotional health.
Yeah. And you too, Bev, because again, these things spread within families and you're living together. So you have to, even if you're super healthy, Bev, be careful. because if
Yeah.
you bring it into them, you may give it to them before you even know you're sick. And, that would be a tragedy, and it's happening a lot. So I would say you guys have still got to hang on a little, and maybe Krista will have good ideas, or, come up with something to bring the outside in. Like, I'm watching a lot of cool movies and stuff, I don't know.
Thanks. Are we ready for me now?
We're ready.
There are helicopters overhead. I just got a text message from the city of Santa Monica saying that there's protests in 2 different areas of Santa Monica. And one of them they're peaceful protests. And one of them is a block from my house on Montana Avenue. So, and Marisa, who's with us, she lives right off of Montana as well. We're on the same street, but just a few blocks up. So that's the helicopters. I think it's super interesting that 2 weeks ago we made this decision we can call it a group decision, it seemed like it on some level, to address the emotional health concerns when it comes to COVID-19 and this experience that we've been having, especially with what's going on in the world this week. Things have gone a little mad, and we can either determine that it's COVID related or not. I'm not going to try to interpret that today. That's not really what my job is. I can only interpret things for myself. And that's really what the emotional health work is about, in my opinion. It's about us taking responsibility for our own selves, our own thoughts, our own feelings, our own beliefs, and therefore the way that we decide to go out into the world. In the book that I teach, and I've been studying this work for 20 years, Invisible Warfare, that Karen showed earlier. Invisible Warfare was written by the late Mona Miller. She was an extraordinary woman who had a lot of amazing ideas. She had experienced a tremendous amount of challenge in her life. And what came out of the learning, she, as a young woman, was in a wheelchair, and what she learned to bring her health back was the connection between the mind and the body, and the work that needed to be done mentally and emotionally to be able to heal herself physically. And so it's work that I've practiced for a long time, as I said, for 20 years, and I'm still practicing, and some days I'm better at it than others. So when I was really thinking about, like, well, if I have, a half an hour to discuss this with you guys, what do I want to talk about? Because the book itself is, it's 450 pages. So I was like, well, what's the highlight? Like, what's the most important thing? And I do spend a lot of time talking about this. And as I go, please feel free to ask questions as I'm going along here. I would say on a very personal level, I don't think that I've done a very good job of my emotional work during this time. I realized last week I went to the mountains to Shaver Lake, and I went with some friends, and it was a calculated risk in the cost benefit analysis. Because I was like, we're gonna go with these friends, they're currently healthy, but we're then bringing more people into our circle of our COVID circle, Safer at Home. And we're going to be going on the road. And, we've talked about things like this here in this COVID conversation. And what I realized was, when I was making the decision, I was like, I'm a bit depressed right now. Like, I'm feeling depressed. And there was all kinds of indicators of the depression for me. Now, in this work, we call depression, how we define that is depression is the suppression of emotions. So we become depressed when we suppress our emotions. And suppressing our emotions would look like not allowing ourselves to feel when we're having a feeling. And we might do things like addictive behaviors, drinking too much. I've heard a ton of conversation personally and on social media about, how happy hour keeps getting earlier and earlier for people during the time of COVID. In terms of people, and I know there's a lot of bright line eaters that are following this COVID webinar series. It might be breaking your lines, might be indulging in flour and sugar and binging on foods that include flour and sugar, or maybe just binging on other foods. So excessively watching, television, or engaging in social media, or pornography. I mean, it could be all different kinds of things that we're numbing out so as not to feel. So that's kind of the check-in. For me, one of the things was my lines have not been bright, so that I know that when my lines aren't bright, I would tend to binge on foods that I'm not supposed to eat, according to myself, because they don't work for me. I have also, I noticed that like my house, I couldn't seem to get my house under control. It was just like there was a mess and a pile here and a pile there, and like there are piles that I couldn't get my head around addressing. For me, that's an indication. And the indication didn't get clear to me until I made this decision to go to Shaver Lake, which is north of Los Angeles. And what it made me start thinking about was this cost-benefit analysis of what we do mentally for ourselves while staying safe. And so there's a couple of different roads here, right? Like, how important is it as human beings, as these pack animals, herd animals, to be with other human beings? And then some of us more so than others, because some of us are introverts and some of us are extroverts, but extroverts really feed on that connection with other people and live connections. So we can look at that. For me, what it came down to was I was like, holy shit, I'm depressed. I'm suppressing my emotions. It's looking like this, and some of it too, you're like, what we can do sometimes too, we get addicted to fighting. What I noticed a lot was like me getting into fights with my son. And there's nothing pretty when you get into a fight with a 12-year-old, okay? So, and then we go to this thing that we call in invisible warfare, point counterpoint. Nobody wins in point counterpoint. In fact, that was happening in my home as a reflection of that. In the world right now, we're seeing a lot of point counterpoint. There's not a lot of this idea of coming to a place of understanding. Point counterpoint is often judgmental. We have a decision about what we think about something, what we think about somebody, and we're trying to prove our point over and over and over again at all costs. And when we're trying to prove our point, nobody is listening because everyone's focused on the idea of being right. So that's kind of a general overview. So I think it's interesting, and I can only look at the microcosm that is my world, how I was in this feeling depressed because I was suppressing my emotions, how one of the ways that manifested was a lot of point counterpoint. And now I'm looking out into the world and I'm seeing something similar. So I can only scientifically guess based on the data. It's a small experiment, but it's my experiment. And by the way, if anybody has any questions as I go along, please ask. So, because I'll keep talking, and I'm going to get to some really good brass tacks of what you can do right now from an emotional health perspective. Some stuff that you can really sink your teeth into and empower yourself with. So there's a couple of ideas that I want to talk about. I want to talk about this distinction between judgment and understanding, which is talked about as the foundation of the invisible warfare work. And I want to talk about this idea of emotional pooping. So when we want to come to a place of understanding others, we can't possibly do that until we step into a space where we are willing to understand ourselves. You cannot understand others if you are not in a space of understanding yourself. It's an impossibility. If we look at the idea of the mirror, right? You can only go as far with other people as you're willing to go with yourself. you can only go to understanding people as far as you're willing to understand yourself. And in the invisible warfare work, the goal really is, and Karen, you can jump on if you want to clarify as a student of the work. You don't have to, but feel free to do so, or ask me a question. So what we have to do is to delve into this idea of how do we understand ourselves? Because we're very simple in many ways and extremely complicated in others. And I would say that we can simplify the emotional work, but the truth is it's very complicated, because generally what's happening with us emotionally is not something that's actually really happening right now. It's something that happened a long time ago. And typically when we get upset, it's not about what's happening today in this moment. Although a lot of times it really feels like that. It feels very much like that. It feels like, holy shit, when am I going to get out of this, these four walls in COVID? And chances are, yes, I'm being triggered right now because I don't have freedom of movement. But the truth is, there was a time a long time ago where this feeling happened first. And we call that time traveling. So part of the work is to get to the root by asking ourselves very open and deep questions about, like, where did this come from? And so we'll ask ourselves, and in this emotional processing, this reminds me of, I remember when. And this is where it's a much deeper process, because it's not just like, oh, I'm sick of being in these four walls. But it's like, when in my past of my life, well, I would say past lives, I am not going to get into that today, because that's a whole other thing that's really complicated. But when in my past of this lifetime, have I felt this way before? Because chances are there was a time where I felt like I lacked freedom and no one was listening to me. Nobody was asking me questions, not because they're bad people, but because they didn't know how to, that they were limited and they were just doing the best they could do. So I hope this is all making sense to you. One of the processes that we do is we actually spend time sitting with our feelings. We call this rinsing. And what I'm going to do is I will share with all of you, as part of the follow-up, a sheet. There's a sheet that I've created that comes from this book. It's in the back of the book. It's in the appendix. In the back of Invisible Warfare, and it's appendix, let's see what it is. Appendix B, the feeling rinse paper. And I have this on a PDF, which I will share with you. And the way the feeling rinse paper goes is it's just digging for feelings. Part of our job from an emotional health perspective is to be archaeologists of our own feelings, getting super curious about our feelings. Because we have no idea where the feelings will take us. What I know for sure is that on the other side of feelings is wisdom. On the other side of feelings is truth. What if in this experience of COVID-19, you were having some feelings, but actually this experience could make you a much wiser, clearer, happier human being? I believe it's actually possible. I believe that in the discomfort, amazing and miraculous things can happen, because I've seen it happen myself. If we're willing to sit in the discomfort of the feelings, not eat them away, not drink them away, not, oh my gosh, I was going to F them away. Not that effing's a bad thing all the time, but you want to check in if you're effing something away. Sorry, what comes to me comes to me. But how do we take charge of our lives? And this is what I call emotional pooping. So when you have toxicity, you need to get rid of it. If you have toxins in your body, For example, we eat food, and it's funny because my son just actually had this science unit in school. We eat food, our body takes what it needs from the food. The rest, if it stays in our body, becomes toxic. So we let go of the food, right, in the form of like urination and defecation, right? So just like, and if you don't poop, sorry for people that don't like that word, but I'm going to use it anyway. If you don't poop, you'll get really sick. You'll become septic. You'll become toxic. Your body will turn on itself. You'll be sick. The exact same thing happens if we do not emotionally poop. If we do not let go of the toxic feelings and the toxic emotions and the toxic stories that we have that may not be obvious to us. We just might be getting into a fight with our son or daughter or husband or friend or what, partner. So this idea of emotional pooping is just like we need to poop every day to get rid of the toxins in our bodies. We also need to emotionally poop. And so one way that we do this is that we take time every day, even if you're not having a bad day, to really sit with our feelings. And a wonderful way to do this is to go through this Appendix B, which we call the feelings rinse paper. And it's sentence starters essentially. So it's a writing exercise. I like to do it in the vein of, if anybody is familiar with it, there's a book called The Artist's Way by Julia Cameron. And Julia Cameron, part of the tenement of The Artist's Way is that each morning you wake up and you write 3 pages in a notebook. And it's just stream of consciousness. It's not like overthinking, you're not writing something to share with the world necessarily, although at some point you might take some work and use that to share. You take the time just to do a kind of an emotional dump. It goes back to the emotional pooping. So because I've been doing this for a long time, when I do my writing in the morning, my 3 pages, I just write my feelings out. But what's beautiful is we have this feelings rinse paper, and it goes like this. I'm angry because, and that makes me feel. You, if you're mad at someone, ruined my life because I hate you, I hate me. I'm scared because, I'm afraid because, I feel bad because, fuck you because. Sorry, we use the word fuck. I'm not actually going to apologize for it. It's a strong word for some people, but we use it because we want to bring about a strong emotion. We want to pull that out. And sometimes the F word allows us to do that. I am guilty because, I'm ashamed because, I'm embarrassed because, I'm disappointed because, I feel sad because, I'm hurt because, I feel sorry for myself because, I feel sorry for you because, I love you because, I like you because, I love me because, I like me because, I'm happy because this makes me feel. We can go on. I'm disappointed. I'm frustrated. What I love about this sheet is that it just kind of gets you going, and you can decide what feelings you're having. Some people do not like the idea of being angry. It's a feeling that has been unacceptable. And so if you, when I've read this, think all of a sudden like, oh my land, it's like, I'm not angry. I'm going to say, okay. And I'm going to challenge you to just check it out and decide for yourself in your processing, is that true? Is it true that you're angry or not angry? I haven't been very angry. But I'll say that when I started this work, I was more sad than angry. For many people, the sadness sits below the anger. So you have to get through the layer of the anger to even find the real sadness. So for some people, the anger is more accessible. And once they chip away at that layer, then the sadness comes. So often we're angry and then we might feel sadness and start crying. So the other pieces that I talked about a bit, is this idea of time traveling. So after we write the feelings out, we will write, this reminds me of a time when, and I remember when, and remembering this now makes me feel. So then we can start processing stuff that happened a long time ago that we never got to process. which is really hugely powerful. And sometimes it's hugely surprising. Like all of a sudden you're like, Susie in second grade said a mean word to me, and I'm remembering this now. And not that like we need to walk around the planet feeling angry about Susie hurting our feelings, but there's something very real inside of us that just needs to have the time and space and understanding about how that impacted us. So it's not good, bad, right, or wrong. It just is. But it's a truth of something that we're carrying around inside of ourselves. And the processing allows us to pay homage, give honor to the parts of us that got hurt. Even if it feels innocuous, sometimes it matters. It matters, and we need to be heard. And the person that needs to hear us is ourselves, our higher self, our adult self. We need to hear ourselves. So then another part of the process we do, and you'll see this in the sheet, is we go to a place of I wish. Because once we process the big feelings that come out, and then we remember what happened in the past might be triggering what's happening in present time, we can start recreating. We can start recreating what we dream to have. And it might be like, I wish to get out of this house and take a walk. My truth is that I don't want to be inside, but somehow I made myself a prisoner in all of this because of something that happened to me a long, long time ago. And so all of a sudden it's like, oh, I have clarity. I have understanding because I've let go of that. I've taken a lot of times I think about the emotions as this idea of a boiling pot, that there's a pot that's boiling over and there's a lid on it. And when the boiling pot's like this and it's like, it starts shaking and it like looks like then it explodes. We don't want to explode. We want to just let the steam out of the pot. So we can breathe a little easier so that we can have clarity of mind, so that we can understand what our way forward is. Maybe not forever, but for this moment or for just today. So my suggestion is, if anybody wants to sort of play with this, is to set up a space for yourself to do a writing practice, especially during this time. So whether it's in the morning, that's my preference, or in the evening or midday, is spending some time with yourself every day, writing out your feelings. And I will give you the writing sheet as a way to guide that process. Karen has a question. She said, I had an experience just yesterday where I was reading a novel where the protagonist had the same experience that I did several years ago. I found myself immediately getting upset, sad, mad, as it reminded me of this situation. I immediately did a little processing on it, and it helped a ton. Reminded me of how much we all stuff away and try to forget, that it's still there and ready to ambush us. Yeah.
Should I go back to that? Like I was thinking, I had heard about this kind of nice book that's supposedly an underrated American classic about a university professor. So I decided to read it. And oh my God, it's like this poor guy, but it's so well written because the author himself was a university professor and all these things are happening to him. And I had the same experiences, and how much pain is coming back. Should I be going back and looking at that? I mean, maybe COVID made it more acute or something, but boy, oh boy, I have to put it down every so often, but I went crazy. I got my cat, like, it's not a wiffle ball, or it's not a wiffle bat, but it's part of a cat tree that I took apart, and I started beating my bed, and I called some names that make F seem like a gentleman.
So what Karen's referring to is that sometimes in this work, and I think the writing is kind of a way in, is that there's also a physical process because we hold all of our experiences and our feelings inside our body. And the way that we can alleviate the possibility of getting disease is by getting it out of our body. And so if we do a physical process in conjunction with the writing process, it can be really super powerful, really powerful. So I'm wondering if anybody has any questions about what I've talked about, because I know it's a lot of information. And I did it pretty quickly. I can't believe I did my overview. Karen, tell me, based on you have this experience, like what questions might you have for me if you didn't know about this? Like does anything seem confusing or?
Okay, I think it was clear, but I've gone through it, so it's different. Like I've been through the process, but maybe you could describe, maybe give an example of like you're upset about something and you're going through, like exactly describe a situation and what would you write in your, I feel this reminds me of.
Yeah.
Like give a concrete example of something maybe recently happened to you because
it's interesting. I actually have it right now because it happened to me today.
Okay, great. So you got one at the ready.
I do some processing. So, and my intention in all of this work is never to really get political, although I have my own beliefs. I really try to be in a place of understanding that you have your beliefs and I have my beliefs and we're all together. But this could sound a bit political and it's not my intention. So all of this stuff that's happening around George Floyd and, I mean, helicopters are overhead. I have my own feelings about it personally, because I have a biracial child. He has brown skin. The world would identify him as Black. So I have feelings about it, but I have feelings about it being a white woman. So it's a bit tricky. And so I'm working through and processing this stuff. But what's interesting is I had some conversations over the last couple of days with family members who have not considered our situation at all. And so I found myself in a bag of chocolate covered pretzels. I mean, literally, I was like, well, I don't know if Maria's still on, but I saw her last night. I was like, all of a sudden, I was like eating chocolate covered pretzels and like there wasn't enough of them. And I was like, what is wrong with me? Right. And that, by the way, what is wrong with me a lot of times starts out as a judgment. I'm not understanding myself. I'm judging myself, like that there's something wrong with me. Right. So then I actually, what I did, I didn't start processing. I called a friend and I just sobbed with her on the phone. She was and I was sobbing because I was like, wow, like I feel so misunderstood. And then what the processing told me is, as a child, I often felt misunderstood. I grew up in a family that was different than me. I grew up in a family that the best way that I can liken it to was that they spoke English and I spoke French. We spoke a different language. I just happened to be the kind of an oddball in my family. In terms of like, I came into the world with just different beliefs and different ways of thinking than my family. And so yesterday was about like the immediate stuff on some level, but it went so much deeper than that. And it went into this place to my inner child, my little girl, who is just so sad. She was so sad that she wasn't understood. And again, in that there's no good, bad, right, or wrong with that. But in order for me to avoid eating the chocolate covered pretzels, I have to process that little girl that still feels so sad. And it doesn't mean that I have to like walk around the world with this like badge of like, I'm a wounded little girl. Because by the way, we are all wounded, in my opinion. It's just the way it is. It's just how it's set up. My job is to come to this place of understanding with myself. So I do the processing. I take responsibility. I don't judge it. I try to understand it. And the more processing I do of this, I'm like, oh, of course I'm upset. Like, of course I'm upset. It makes perfect sense. And that's okay. And my job is not to blame other people for having made me feel that way in the first place. It's just holding the space for my little girl to be sad about it, giving myself that time and space to do that. And on the other side, it's like, okay, so what do you want to do about it, Kristen? Like, is there something you need to, is there a conversation you need to have? Are there questions you need to ask? Like that kind of goes into the I wish. Like maybe part of me still wishes to be understood. And so I might have to go to somebody and say, hey, do you want to know how this makes me feel? And by the way, I'm asking a question, right? A yes or no, because everyone gets to have a boundary of like, no, actually, I don't want to have that conversation with you. And then I have to be okay with that. So then I have to be okay with, I have to find ways to support and love myself because not everybody's going to understand me, but I can understand myself. And that's the biggest thing. I think people get very angry, whether it's obvious anger or it's hidden anger, when they feel like people aren't understanding them. But the truth is, it's never anyone's job to understand us. It's our job to understand ourselves. And then we can go out into the world and hold a space for understanding for other humans. But until we get into the practice of understanding ourselves, loving ourselves, and it doesn't mean that sometimes we don't stand up for ourselves. It doesn't mean that we don't have boundaries. It doesn't mean that sometimes we don't approach uncomfortable conversations with people, because sometimes we do that, but not in a way, ideally, that's about getting into a fight or point counterpoint, but it's saying, hey, like I actually have an opinion about that. Would you like to hear it? And then by the way, like what might happen to me is I'd be like, hey, can we talk about this? Because it's like really hurt my feelings. And then I get a like, no, not interested. And then I have to go back to doing my processing because I might still be hurt that they don't want to have a conversation, but I have to hear that they're not interested because of where they are in the world, not because they're good, bad, right, or wrong. It's not for me to blame them. It's just, oh, okay, I get it. You're not available for this conversation. So I have to process through this on my own. And thank God I'm a big girl and I know how to do that. And then I have a community of people that if I need to have a conversation with someone that feels like they understand me, I could do that. Like I go to have those conversations with people whose hearing is open and not closed to what I am thinking and feeling. Did that answer your question, Karen?
I think that was helpful to make it just one step more real, because you gave a lot of info in a short period of time. And, but I just commented, I would definitely have been going snout first into my own drug of choice in these. It's very hard right now. It's very hard. And, there's a lot of people polarizing around it. And again, the way I'm feeling with COVID, I think we can apply to that too. I can only hope that this will catalyze changes for the better. Long overdue changes that, like what got me most, we were chatting about this, what got me most about George Floyd, heck, we had Eric Garner not all that long ago. And it's like, we got to be learning. Why aren't we learning?
What I want to put that back on to, Karen, is not what's happening outside of ourselves, because we can do that. And I've had a lot of conversations over the last couple of days about that, like that outside of ourselves. And I think what we have to keep doing is coming back into ourselves and saying, what can I do? And because there's not a whole lot that we can do about what anybody does on the whole planet.
That's true.
Unless we're controlling them somehow. And that's no fun. I mean, it might seem like fun, but
we can't anyways, particularly the cops, right?
Right. And so it's like, well, what is Karen going to do for Karen today?
Yeah.
Like, how is Karen going to sit in this place of understanding? Where does Karen keep seeing the same thing over and over again and creating the insanity of doing the same thing over and over again? And
I even came up with a plan, like in keeping with that, what it really brought into my mind is it's very easy to judge a lot of people in these situations, right? Judgment jumps to your mind. And, that's a little bit there too, just in terms of, well, I think as citizens, we've got to look a little bit at the militarization of the police. We've got to be a little more, what's our local police force
And
training?
by the way, I would go back to this on you, Karen, because I'm just going to bust you. I'd look at the militarization of yourself. Like,
Yeah,
where is that?
or just,
I think
well,
that we have to
that
keep
too,
putting it back on
absolutely.
ourselves. Like,
No,
where are you
yeah.
militarizing yourself?
Yeah, because obviously this only happens in a context where there's a population that'll tolerate that. But
Yes.
it really got me thinking, how will I stop escalating a situation? How, like, I really started, I thought in 2 dimensions, like, how can I represent, a kinder, gentler way of responding to a bad situation, or, whatever comes my way. Like, how can I stop from ratcheting up, which is so, in these stressful, tense moments, it's easy to ratchet up. And I also started to think, like, these situations provoke a different kind of thinking. And this has helped me in other kinds of ways. Like, I picture, if I were to come upon a scene like that, how would I react? What would I do to maybe do better? And I've even come to the conclusion, I might try to pull a cop off someone if I saw that. I mean, it could get me killed maybe, right? But at least I would be acting from an authentic core, And again, maybe, I don't know, but I might intervene more dramatically. Those people were really helpful.
And that's why I'm going to bring it back to Sim to keep getting her, because she keeps trying to make it outside instead of inside.
Well,
this work is 100% inside. I would say, where's she pulling herself off of herself? The part of her that's judgment, that's harsh, that wants to put herself down, that sticks her knee in her own neck. That's
true too. Yeah, I've certainly done that.
That's what I would tell Karen. So she wants to keep putting it on the outside. Do you notice that? And we all, by the way, it's not because she's like different.
No, we all do that.
We all do
act
it, but
in the outside.
It's more comfortable to look outside of ourselves than to look inside of ourselves. So this emotional processing, the emotional pooping process, the detoxifying of our feelings, it's all, the beautiful part about it is you don't need anybody else to do it. Like, it is unnecessary to have somebody else do it. Now, is it good to have support? Absolutely. Is it good to have, peers, whatever, that you go through the process with? Like Karen said, she's done the invisible warfare group. She's starting again on Monday with someone to walk through it again. It's wonderful to have someone to talk to about it, but it's something that, like, you are completely empowered to do on your own. And I'm going to share the worksheet with you. So just want to make sure that we don't have any, because we're coming to time here. Any questions? I want to leave that. We still have a lot of people on here. And so I'm assuming that there's something interesting to you about this. If you don't want to ask a question publicly, please shoot me an email. I do teach the book, and my point was not to tell you about that. I don't even know when I'm going to do my next group. I'm sort of on hold right now, while we're sort of navigating this stuff. I'm not ready to make a decision about that. But I do teach the book, and we'll do another group at some point, probably not until September, I'm thinking. But if you have any questions, I am always here and always open to questions. I'm kind of a geek when it comes to emotional processing, so would always love to entertain a conversation about it. And if you just want to have a deeper conversation about it, like an in-person, in a Zoom or a phone call, I'm happy to do that as well. So yeah, I'm sort of fascinated that no one's asked questions, but maybe they're just digesting the information. Jean says, thank you, Kristen, for reminding me of all of this. Went through much group counseling years ago, and this brings me back and reminds me of how to do that work. Yay. Great. Let me know how that goes for you. And interestingly, I'm heading into my birthday week. My birthday's on Thursday. And we're heading into a new month. It's June 1st tomorrow. And my birthday present to myself is to really sort of rework my process and commit to my daily practice every single morning. Because I know when I'm doing the work every single day, my life becomes miraculous. And even when I'm not having a bad day or think something's wrong or whatever, stuff always comes up, and it's when I am in my most creative space in terms of creating the life that I truly desire to have and to live, and the way that I want to show up and I want to feel in my life. So that's what I'm doing in this for the month of June for myself. Mary says, if you're always turning it back on yourself, how do you get to the point where you share your opinion with someone else? Ah, that's a great question.
Mm. Mm.
Our job is actually really not to share opinions with people unless they've asked for them. Our job is to ask questions. So sometimes you can say, do you want to know how I feel about that? Even in my coaching, as a coach, our job is to really ask questions. And sometimes I'll say to a client, do you want my advice on that? Like I'll ask for permission. Do you want my advice? And sometimes they'll say yes. But giving advice and giving people your opinion can be really disempowering to people. And especially, and by the way, it doesn't mean that your advice, your opinion is not good. It just means that, it might not be the best approach. One of the most amazing things is when my son was in preschool, he went to a wonderful preschool in Santa Monica called The Growing Place. It was based in the Reggio Emilia philosophy. And he had a teacher in his TK year. Her name was Peggy. And Peggy never answered a question. She only asked the next best question. And I saw that work, and it was so, so, so powerful. It was so powerful. And she was really just gifted in knowing what the next best question was. And I think that's a lot of times the work of coaching. Really, it's like, what's the next best question? Because we all have the answers inside of us. So I don't know if that helps you, Mary. If you have another follow-up question, please feel free to share that. But, people have their hearing must be turned on for them to hear what you have to say. I'll actually give one I'll give you actually a little anecdote about that. When I was doing my very deep into my healing work with Mona, I worked with her for 12 years before she died in 1991. I started with her in about 99. And at one point, my father had come to Los Angeles, and I said, hey, I'd really love to do a session with you and Mona. And he said, okay. I mean, he didn't want to do it. He was doing it because he loved me. My dad passed away 5 years ago in 2015. The time came where it felt like it was time to talk to my dad about some things that had happened to me as a little girl around some abuse that I had experienced. And Mona asked my dad, do you want to know what happened to Kristen? And my dad said no. And it was hard. It was hard to hear that. But at the same time, that was his truth, is that he didn't think that he could handle whatever it was. He didn't think that he could handle the information. And so his truth at that time was, no, I can't do it. And I don't have, my dad's been gone now for 5 years. I don't have any resentment towards him. I have actually a compassion. My compassion is that sad for him that he couldn't do that. And so sometimes that's the thing. We have to ask for entrance into those conversations, and we have to be okay with what people's boundaries are. It just has to be okay. And, I know it's complicated when it comes to relationships, because if it's your child or your partner, your spouse, it's tricky. But then we get to decide, do we want to be in a relationship with people that don't want to have these conversations, or whatever that is? Then it goes further down the line, but we have to start asking permission. That's what coming from a place of understanding is. We have to ask permission. I hope that helps, Mary. Any other questions before we sign off today? Well, I appreciate all those here and interested in listening to this information. It's very near and dear to my heart, and it has changed my life, like in the most incredible
Me too.
way.
Mhm.
So thanks. I know Karen's been a great student. Have you,
I loved it.
I'm sure you guys aren't surprised that she's a great student.
Yeah, I definitely know how to be a student.
She knows, but you do the work. You're not just going through the motions, you're doing the work, Karen.
Yeah. Yeah.
Karen, what would you say just for everybody to hear? Like what, and I know you talked about it a bit, but maybe I'll ask that question differently. Like, what is the most profound thing that has happened to you in doing this type of emotional processing work?
Okay, let me put it in a general way so it can be fast. I sort of feel in many respects, I was kind of sleepwalking in a couple of domains of my life, and I woke up. And that sleepwalking, I could have continued for the rest of my life and just ended up, who knows where, honestly. And I definitely feel like I'm at the wheel of my life now in a way I wasn't before.
That's beautiful. That's beautiful. Thank you.
So I recommend it. If Kristen does another, I recommend.
And then if nothing else, I'm gonna send you guys the PDF and our follow-up, and my goal is to get that done sooner than later. Maybe even today, tomorrow. So that's it. I don't think we have any more questions. Karen, thanks for sharing that. That's beautiful. It's really a beautiful visual. And I believe that too. That's been my experience, is that
Yeah. Mm-hmm.
for a long time in my life, I was just going through the motions because I didn't know how. That's the other piece, is that, we're not taught emotional processing. So it's normal that we wouldn't know how to do it because it's not something that's taught to us. And when you get to learn it, you get to really learn a whole new way to live and be. It's pretty extraordinary. I'm sending lots of love to all of you. I'm sending good health and safety. And if you have any questions for us, let us know. I guess we'll be back next Sunday for more COVID. Plan?
Not. Let's see. We're starting to kind of come into we might see cases going way down, and then we'll stop. If people don't keep.
Yeah, or maybe we'll, so I think we'll do it next week for sure, and then, maybe we'll
then reassess.
Not do it every week, or we can whatever. It's
do
cool.
it monthly.
You just make up your thing. You can do whatever you want. All right.
Okay,
have a great week, everybody.
Have a great week, everybody. Bye-bye. Take care.
Bye.